morning. I'm going to be demonstrating a basic IV insertion. So my first step is going to be checking the doctor's orders for the type and duration of IV therapy, as well as comparing that to the patient's lab values and allergy history. And that's going to help me determine the catheter size. So after I've compared everything, I'm going to prepare my equipment. I already have a 3 milliliter saline syringe. I'm just going to go ahead and prime my INT tubing with those 3 milliliters real fast. Alright, so the syringe is primed. Got alcohol swabs, tourniquet, gloves, the IV catheter, my Tegaderm, and some tape. So I'm ready to go into the patient's room. I'm going to ask them their name and date of birth, compare that to their wristband, and compare that to my MAR to make sure I have the right patient and they're going to be getting the right procedure today. I'm then able to choose my site. I'm going to be choosing the most distal site in the non-dominant arm, away from any areas affected by ADLs, and I'm going to assess that the vein is soft and bouncy and not tender upon palpation. Once I've determined that vein, I'm going to apply the tourniquet 4 to 6 inches above. We're going to go ahead and go right down here. So now apply the tourniquet. Go ahead and wash my hands. Come over here and alcohol swab the area using circular motion and larger. And allow that to dry. As that's drying, I'll place my gloves on. The radial pulse is intact, so we are ready to insert this IV catheter. So next, I'm just going to get this, make sure this is loosened up. I'm going to pull the skin taut in the opposite direction. I'm going to go at a 15-degree angle with the bevel up into the vein, looking for a blood return. As soon as I get a blood return, I can advance another 1/4 inch. And then I'm going to slowly just advance the hub to the skin. So once the hub is to the skin, I'm able to take this out. I'm going to try and apply pressure in the front of this vein, keeping the hub steady as I touch the saline and releasing the tourniquet. So applying pressure, keeping this steady. I'm now going to check for a blood return with my saline again, unclamping, check for blood return, see blood, so now I can push saline, flushing it out, and then I'm going to apply the clamp again. Now I may unattach this saline, and then I'm ready to secure this. So I'm going to grab my Tegaderm, apply it over the hub. I'm going to take the label. I'm going to put the date and time, the catheter length, or catheter size and length, and then my initials. And then I can place this on here, away from the actual site so that you can view the site. Next, I will be securing the rest of this. with tape. Make sure it's not moving around everywhere, so it'll stay in place to the patient, not be painful. All right, so now that my IV's been placed, I can, I would have asked the patient or warned the patient that they're about to feel a sharp stick as well when I place that in. But I'm going to assess the site, make sure there's no infiltration, no redness, swelling, and then I'm going to take off my gloves, going to dispose of the sharps in the appropriate container, wash my hands, and then I'm ready to document the time and date, the size, and that I placed a 20 gauge IV catheter in the left lower forearm, that I only needed one attempt to complete it, that the patient tolerated the procedure well, and that they were educated to alert a nurse or healthcare provider if they had any sharp pain coming from the area, if they noticed that there was swelling or redness at any time, and that's it.